Next on our panel, we have Nilanjana Ganguli, also known as Nell. She is a PhD candidate in the Faculty of Environmental and Urban Change at York University and brings a unique blend of biotechnology and environmental studies skills to her doctoral research. Her research takes an intersectional systems thinking approach to modeling the gender health impacts of climate change in Malawi's capture fisheries. Nell's academic journey includes a master's degree in environmental studies and a bachelor's degree in biotechnology from York University, and 3 years of biotechnology research technologist training at Seneca College. Nell worked in the mining sector for 6 years in West Africa, where she was involved in multiple facets of the business, including HR, communications, and corporate social responsibility. While working in the mining industry, she recognized a need for better integration of health into corporate social responsibility plans, which inspired her to return to academia to learn about the intricate relationships between the environment and human health. She was a project manager for the Dadala Institute project, complex adaptive modeling of the health impacts of climate change in Malawi from 2022 to 2024. She works as a graduate research assistant grant writer for the Malawi team and volunteers as a grant manager for the Leadership in Environment and Development, Southern and Eastern Africa. Nell has lived in India and Tanzania and now resides in Toronto, Ontario, where she moved from her post-secondary education. She is fluent in Bengali and Hindi and has elementary skills in Kiswahili. Nell loves to explore different cultures through cooking, traveling, and stories. Thank you very much for being here, Nell. We look forward to your presentation. Let me share your screen.
All right. Oh. Can you see my slides?
Yes, we see that.
All right, okay. I completely forgot how long of a bio I sent to you. Thank you for reading that out. Hi, everyone. Very, very excited and very fortunate to be included in this symposium. So big thanks to the Pegasus Institute. I'm actually more excited for listening than presenting. And thank you, Dr. Sloy, for starting this symposium off so amazingly well. Full disclosure, mining is not at the moment my focus of research, but what I am about to present to you is a seed grant project that myself and a colleague at Dadal Institute did end of last year. And we really took a more holistic approach to understanding what the health impacts of, this green transition, critical mineral mining is and can be. And that's what I'm about to present to you. I won't spend too long on the problem. Dr. Sloy has already, really explained the issue. But I will quickly say that since 2017, the energy sector has actually increased the demand on critical mineral mining, basically tripled the demand. And according to the IEA, the demand for cobalt and nickel has, since 2017, has increased by 70% and 40% respectively. And the World Bank states that worldwide demand is expected to further increase by 40 to 90% by 2040 if we are to meet the goals of of Paris Agreement. We spent some time understanding why there is a surge, and I've quickly listed them here, and some of the impacts on, the carbon footprint. And one of the major factors, of course, without a doubt, that renewable energy is one of the most effective ways of decarbonizing the energy sector. But the material and carbon footprints of clean energy technologies is substantial. One of the primary factors of this is that Clean energy technologies such as solar plant and wind farms and electric vehicles require more materials to build than fossil fuel-based electricity generation technologies. So, for example, a typical electric car, for example, requires 6 times the minerals of a traditional automobile, and an onshore wind power plant requires 9 times the mineral resources of a natural gas plant. Also, with the rapid rise in demand, the threat of resource constraints is also looming. Most of these resources are, of course, Canada being one, but also in some parts of the world where governance and mechanisms and corruption is there's a lack or poor governance mechanisms, and or I should say, I've worked in the mining. Some of these mechanisms are not respected, mostly ignored, or just suppressed. The other factor of the surge is that currently there is the lack of and rather poor recycling technology, or it is very expensive to recycle critical minerals, which is also causing the surge in demand for virgin land, for virgin extraction around the world. And of course, Dr. Soy touched on the geopolitical, issues around the world, in this context. So I will quickly move into the health impacts. So we really, our research question was how is the extraction of minerals to support the global energy transition impacting health at the local level. The method was systematic scoping review. We looked at both academic literature as well as gray literature. And this was the range of, and as I said, one of the reasons for me to leave mining was really, I found that health was looked at from a very sort of reductionist lens. And there are other impacts such as mental health and substance abuse and zoonotic diseases, which are not really focused on in sort of corporate social responsibility, at least back then when I was working. And going through this, doing the scoping review, it's actually fascinating to see that they're still not focused on, and most of these health impacts are still what I saw when I left in 2017. There's still more focus on pollution, and occupational health. So I won't discuss them all, but I'll quickly go through some. So the first one that we looked at was occupational health, and this included injuries, musculoskeletal impacts, as well as workplace accidents. And some of the authors that we found writing about this said that because with the demand of commodity going up, some of these mines that at one point were deemed too risky to mine are being opened up. And not just that, the rate of mining or how quickly they are approaching or starting the extraction is also increasing, which may pose risks which may increase these occupational health risks. And as we have all heard in some contexts, mining also involves children as laborers. And it's not just that they are equally or more susceptible to these occupational sort of physical health risks. There are cascading impacts on their education because they are usually withdrawn from school too early. Another angle of occupational health is the artisanal mining camps that I have seen personally in Burkina Faso, and I was personally quite shocked how dangerous these mining sort of scenarios, mining, the way they do the artisanal mining. And most of these camps are set up near large-scale mines, which are active or abandoned, and both has its different share of risks that it poses to occupational health. And then the next that we found many articles on was water, soil, and crop and air pollution. Dr. Story has already touched on some of these, but I will say that one interesting finding that we found was on crop pollution. So it's not, it's definitely not. It reminds us that it's such a complex problem, especially in crop pollution, because not all crops absorb trace metals and minerals at the same rate. So for example, we found one study in Portugal, they found that these berries that were grown in close proximity to mines did not actually absorb a lot of minerals, whereas mushrooms did have a very high concentration of mercury. And again, some of these pathways of exposure is through ingestion, respiration, and dermal pathways. So I'll move into the zoonotic diseases, and this was one of our primary sort of interest to see how much material is out there, what people are saying about it. So again, as I mentioned earlier, not a lot has been studied on, not a lot of studies linking zoonotic diseases to mining or health impacts of mining. And we found that, and some of the authors that are talking about this and some of the gray literature that we found are basically saying that, are basically linking these two by saying that mining is mostly done in very remote areas. And this is the same, West and Central Africa. I worked in Burkina Faso, which is in West Africa, and in a very remote area in Burkina Faso. South America, and then in East and Southeast Asia. And these are the same areas that they find the main outbreaks, of zoonotic diseases. We've all heard about Ebola. I was working in mining when the Ebola outbreak was on, and I used to take care of the logistics. That was part of my job. And it really adds, you can really see how an outbreak of Ebola, like a zoonotic disease outbreak, can not only cause increase health risks of workers as well as communities around the mine, but also really puts pressure on logistics and how the operations are run. The other link that authors have made is that mining extractive projects cause substantial changes in local ecosystems, landscapes, and populations. And these changes impact animal populations and behavior in ways that can increase the risk of disease transmission. In particular, extractive projects can involve deforestation, road and corridor development, creation of temporary labor camps and other facilities, expansions of surrounding local communities and agriculture, and project-induced migration. Also, because extractive projects, again, very situated in remote regions, workers in adjacent communities may be the first to experience emerging zoonotic diseases. And also the remote locations really cause surveillance activities. Surveillance activities are quite tough to conduct in remote regions, and surveillance is considered to be one of the best ways to sort of prevent zoonotic diseases. So those are the connections that we found that authors were making. And then we also found some studies on mental health and substance use, and I think this again brings out the fact that mining is done in many remote regions, and a lot of workers are really work on fly in and fly out basis. I have spoken to workers who've been 6 weeks on. I take care of human resources. I've spoken to many expats as well as local workers in Burkina who used to work, 6 weeks on, 3 weeks off. And some of them have even expressed that being in the camp felt like being in the jail. And we found that, personal experience as well as the studies support these personal experiences, that people do go through, many sort of conditions where they feel depressed or anxious and really looking forward to going back home or missing their families. And we find that studies as well as conversations don't really include the mental illness and mental side of these impacts as much as the physical impacts. And that was one of the main sort of gap in study that we found. In research that we found, sorry. And then lastly, I'll touch on sexually transmitted infections. Currently, I am studying transactional sex in sort of fishing and farming in mainly gendered natural resource economies in rural Malawi. And this interest actually came from mining, and part of the reason why I left mining, because when I was in Burkina Faso, at the camp, visiting camp, I also visited some of the artisanal mining camps, where I found many young women who had left home with the hope that they can become mining workers or start working in artisanal camps. But because these natural resource economies are so gendered, most of the work is carried out by men, and these young girls, as well as women and older women, are really dependent on these primary mine workers to give them jobs to do or pay them. So they need to live, and they also have households to support. So they turn to sex work or transactional sex. And I've heard stories where, the corporate social responsibility team would be speaking to these women, and where we're from, they're very, very, they know, they're aware of the HIV and, STI risks of unprotected sex. But their response is, HIV will kill me in a month or 2 months, but hunger would kill my children in the next week. Another interesting factor that we found driving this, sex work and STI infections risks, or rather, I should say, the unprotected sex exchanges in these camps is the lack or unavailability of the saving culture, where men are making more money, but they don't have anywhere else to spend it any other way, or don't have banks or anywhere to deposit their money. So the next thing they do is they think they have to spend the money as soon as they get it, and they approach these women and offer them offer to pay more for unprotected sex, and the women accept. So that was one of the major sort of factors that I have found and I've heard of, and I was in Burkina Faso, as well as supported by literature. So that is really the end of my presentation. We don't have a lot of time, but if you are interested in reading more about this, our book chapter is supposed to be published next year, and I'll be here till 11:30 to answer any questions. Again, thanks a lot.
Thank you so much, Nell, for sharing that presentation. I think your unique experience both in industry and in academia has given you a very unique lens into the issues around extraction. And thank you for especially highlighting some of the issues of gender equality.